Frigidaire. It means the first electric refrigerator. The first compact electric range. Now, there's the Frigidaire Gallery Range with Symmetry double ovens. It's designed to cook multiple dishes at multiple temperatures, so you can prepare the entire meal at the same time. Frigidaire, over 90 years of legendary innovation.
See the full line of Frigidaire appliances at Ventura TV Electronics and Appliances.
Hi, I'm John Mallos. Welcome to this live edition of Connect with me on the showroom floor at Ventura TV on this Friday morning. Boy, batten down the hatches. I hope you did last night. The rain is here, and it's not letting up anytime soon. That's a good sign to a certain extent. Hey, we've got a very interesting program here today. We're going to talk about the Cardiac Rehab Center over at St. Agnes Medical Center. And in the last 10 minutes or so of the program, we'll talk to Tal Cloud. He'll be guest hosting here next week, Monday, Tuesday, Wednesday. So any questions for him, you can call in at 436-MeTV option 11. We're back in just a moment.
Tonight I want to discuss the importance of the television medium to the American people.
And welcome back to the program here on Connect with me, a Friday morning, and a good Friday morning it is because we're seeing a lot of rain, although in some places in California we see the devastation with some of the flooding and of course, streets just you can't pass. Up in Washington they had a house that fell into the ocean right off the cliff. There's so much rain here on the West Coast right now, so it's either feast or famine with us, huh? It looks like the 4-year drought is over. Hey, you're watching us on Comcast channel 187, 43.6 and 13.1 live, and now, my friends, you can catch the replay. There's the live version Monday through Friday here on MeTV, and then the replay comes later in the day at 2 o'clock in the afternoon on YouTube 13.6 and 8 o'clock at night at 13.5 on Biz TV. And today's program, I am happy to announce that Turf Medics is our sponsor here for the full hour. You know, that's that company where, you don't have to do it now, but I mean during the summer when you are limited to the amount of times you can water your lawn during the week, you can spray that green stuff on your lawn and it looks like the 16th green at the Masters. It'll look great. Lorenzo Neal owning that company and our major sponsor today on Connect with Me. Well, today's show, I think, hits home quite well with me, at least, because many of you know, just a few short months ago, I went into the Cardiac Rehab Center. I talked about it quite a few times here on the air. I had a couple of stents put in by Dr. Edward Hanks back in March, and then I went into the Cardiac Rehab Center shortly thereafter at St. Agnes Medical Center. Quite an experience. I didn't even know I had blockage in both my arteries. 90% blockage in 2 arteries. I could have been dead and gone, and Tal Cloud would have had my job. Anyway, let's go to the videotape. That's a joke, my friends, and I'll show you what I'm talking about. This is on the east side of the St. Agnes Medical Center, right near the emergency room, and a great place it is. It's very, very, very low-key, very low-stress environment for those who want to come in for rehabilitation after heart surgery or some kind of procedure like I had, having a couple of stents put in. There's some of the staff members right there. You've got Maya, you've got Ruben, 2 Marys, Jillian, who's a Yankees fan. You've got Susan, Erica, and Michelle, a fantastic staff over there. Here you got some machines. You got a treadmill, a bunch of weight machines, the pull weights as well, other types of exercises here against the wall, as you see there. Cardiac rehab at St. Agnes has been at its current location for about 9.5 years now. Overall, 35 years cardiac rehab has been around at St. Agnes. And, there they teach you about diet, exercise, lifestyle changes, what foods to eat that are good and bad for your veins. You got to stay away from those foods that clog your veins. It's the only cardiac rehab facility here in the city of Fresno. They have one in Visalia and one in Merced. This is a fantastic place to go back and try to regroup, as they say. Live in our studio right now is Lori Waddell. She is the Cardiac Rehab Center coordinator. She's been there for the better part of, what, 25, 30 years? We'll ask her when we come back. But your questions are really important. If you have any heart issues and you want to talk to your heart doctor about this, but maybe cardiac rehab at St. Agnes would be the place for you. 436-ME-TV, option 11. Call in. Ask Lori, our wonderful guest, a few questions. We're back in just a moment.
As a pro athlete, I played on green grass my entire career and was stunned to find a product that could make my home look as good as the turf I've grown to love. Turf Medics is a revolutionary new turf coloring system designed to reduce watering and mowing. Call 1-888-936-0444 or visit the website at www.turfmedics.com to learn more about Turf Medics by Pro Turf, the real experts in real green grass.
Yeah, you can imagine quite the shock when I found out I had 90% blockage. And, you know, the ridiculous thing about this whole process is that last December, at this very same time, I had blockage. I went in to see my doctor, Dr. Edward Hanks, for a treadmill test, and he told me something was amiss. I went in a second time. He said, something is amiss. Come in for an angiogram. And I said, yeah, I feel fine. I have no chest pain. I feel comfortable, I'm exercising, I'm eating okay. You know, what could possibly be wrong? I waited 3 months to have the angiogram. Can you believe that?
Wow.
I could have been, that was stupid on my part, wasn't it?
Yes, it was.
Lori, it's so nice to see you.
Good to see you, John.
I want to hug you, but that's okay later. How's that?
Okay, absolutely.
How are you? So I love your place over there. It
Thank
really
you.
is low stress.
Thank you.
And just low maintenance. Oh, we have a call already. See how popular you are? All right. Caller, are you there? Go ahead.
Yes, my question this morning would be, what would be the best foods or the best liquids or combination thereof to include in my diet to help my arteries not to plug up?
Okay. I appreciate the phone call. You know, I want to preface this by saying you're not a cardiologist.
Nope.
You're not a doctor. You are a...
I'm a nurse. I'm an
Okay.
RN.
All right.
Yes.
So to the best of your ability, what should we be eating?
Plant-based foods, vegetables, fruits, those kinds of things are the best. The Mediterranean diet is excellent. Lower in meat, higher in fish. The oils that are used in the Mediterranean diet are olive oils, and those are the healthy fats. There isn't a cure-all. I think having a balanced diet is very, very important. We need our protein, so you can't stay away, I don't think, completely from those, unless you're getting, tofu, those kinds of things if you're a vegetarian. But truly, I think the Mediterranean diet, and most dietitians would agree with me, is probably the healthiest diet. And again, that's plant-based. Olive oil is your fat choice, more fish, less beef, those kinds of things. And I think it's well-rounded. You're going to get great vegetables, great fruits, those kinds of things.
How about nuts and grains?
Grains are really, really important. And again, with the Mediterranean diet, you're getting a lot of the grains. You're getting the whole grain breads, those kinds of things are great. Nuts in small quantities are okay. We don't, we always tell people you can have nuts for a snack, but we don't mean the whole jar. A handful.
I brought my almonds
Yeah,
today.
and about
Yeah.
about a half of that is your serving.
For the day. Probably for a
Yes.
24-hour
Yes.
period.
So just a small handful is okay.
All right. This is going to be a popular segment. I know that. Caller, go ahead. You're on the air with Lori Waddell. Caller?
Yeah, just to let Lori and John know, 3 years ago, this July, I was in cardiac arrest. Okay, and I was on cardiac arrest for 3 days. They were already giving me or bringing the family together as far as, just getting the family together and say, well, he's no longer going to be here, right? Mm-hmm. Because I had told him before I didn't want to be on the machine. So anyway, 3 days later, I'm trying to say is, I woke up, I pulled out the tubes, and here I am. This is 3 years later, and I'm 65 years old now.
Yeah.
Now, during the time prior to 3 years, I was heavy to begin with, but I weighed like but I would say 420, and so I got down to about 3. Right now, I'm about 3 320. Okay, so I've lost 100 pounds, so that's how. But my question to you, Lori, is does the treadmill, after having a cardiac arrest, and I was one of the fortunate ones because I'm still here. I'm one of those persons that did not stress. In other words, that during my life I did stress or worry about things, you know, the bills and all that. Because in the person that has a heart attack, because I had a heart attack like 20 years ago, but then I had a stress test.
Your question is about the treadmill. Does the treadmill do any good? Is that your question?
Yeah, as far as, you know, once you had your cardiac arrest and they have stints like yourself, I know what it is.
Yeah. Okay. How beneficial is the treadmill?
Any cardiovascular exercise, whether it's a treadmill or swimming or just walking, stationary bikes, any of those are what we encourage people to do 30 to 60 minutes a day, most days of the week. You want to do cardiovascular exercise, as is being shown now with one of our patients on our treadmill. We have multiple pieces of exercise in the gym because some people don't like to walk on a treadmill or can't walk on a treadmill. So really the best exercise for anybody is the one that they like to do and that they're willing to do. And 30 to 60 minutes, cardiovascular exercise, again, treadmill, stationary bike, swimming, going out and taking a walk, going out and riding your street bike, whatever that entails. Some people love to dance. Go dancing a couple of times a week. I'm okay with that. Whatever gets you up moving that you like to do. And then adding, of course, resistance training is very, very important, especially as we get older. We lose some of our muscle mass, our flexibility, those kinds of things, and you want to stop that from happening. You keep your muscles healthier, you're going to have fewer falls, those kinds of things. So treadmill's an excellent exercise. The nice thing about just going out and taking a walk, you don't need a piece of equipment. All you need is a pair of good walking shoes.
Yeah, and that is the Cardiac Rehab Center inside there at St. Agnes up on the second floor. And like I said, a low-key, low-stress environment there. The staff very friendly, very helpful. And but with the treadmill, you're primarily getting you're helping your heart in what way?
You're taking your heart rate up to, usually we calculate for everybody where their heart rate should be during exercise, and that's the target that we look towards to keep that heart rate up there for that 30 to 60 minutes every day. And that's that cardiovascular exercise that everybody talks about. You know, I do my cardio 30 minutes a day or whatever it is that, you know, whichever cardio exercise they're doing. And that's what helps strengthen the heart. Hope in some people can help develop those collateral arteries that we talk about on the heart that will protect you from having another heart attack. Builds up strength, stamina, all of those things. And, you know, our bodies are meant to move, even though we don't as much as we should. You know, back, you know, in previous generations, people walked everywhere. They cleaned their homes, they washed their cars, they did all those things that today we have people doing those things for us. So now we have to exercise to get that same effect. So 30 to 60 minutes most days of the week is what we encourage, and that's American College of Cardiology, American College of Sports Medicine, the American Heart Association, all of those worldwide and countrywide groups. That's what they suggest.
So they suggest a minimum of 30 minutes a day. That's good for you. So I do 40, so that's okay?
You are excellent. And moderate to vigorous exercise, and moderate exercise is walking on a treadmill at 3.5.
It's 3.5.
It's not that fast.
All right. Hey, Lori Waddell is here. She is the coordinator out at the Cardiac Rehab Center at St. Agnes Medical Center. No, she's a nurse. She's not a doctor, a cardiologist, but that's okay. She's been around for how many years now at the Cardiac?
I've been at St. Agnes for 35 years, and I've been in cardiac rehab for 25.
Wow. So you may not be a doctor, but you've seen a lot and know a lot, and you've worked for a lot of doctors, right?
Worked with them, yes.
Work with them.
Yes.
Yeah, all right. Lori Waddell is here. Hey, call in, ask your questions, 436-MeTV option 11. Today's program sponsored by Turf Medics, that great product that makes your grass look green. Probably don't need it today, but I'm sure you're going to need it sometime in the near future. Lorenzo Neal is the owner of that company. Glad to have you guys along. Back in a moment.
Frigidaire. It means the first refrigerator. It means a history of innovations that help make your home life better. And now we introduce the new Frigidaire French door refrigerator with over 100 ways to organize for maximum flexibility. Built with adjustable flip up and slide under shelving and stackable crisper drawers. It's the refrigerator that flexes to fit it all, no matter what your day will bring. Frigidaire, over 90 years of legendary innovation.
See the full line of Frigidaire appliances at Ventura TV Electronics and Appliances.
Back here on the program, thanks to Turf Medics as being a sponsor here, and Lori Waddell is here. And, you know, we talked a little bit about food. Now, at cardiac rehab, let's say you have a heart attack or you have stents put in like I did. You go in there for the first time. What's the protocol? What will you have these individuals doing? Is it by a written prescription by a doctor, or can you make an appointment to go in? How does it all work?
Most of the time we get patients because they've been at St. Agnes and we capture them while they're in the hospital.
So it's a prescription kind of written by the doctor?
Well,
yeah.
We send them a prescription and they sign it.
Oh,
we kind of do
okay.
it backwards.
Oh, really?
And they
It
never
works?
Yeah, it does, and they never tell us no. They're happy that their patients are coming. And then once they get to us, whether they've had the heart surgery, the stents, or a heart attack, they come to us, and one of my staff, myself, or one of the other nurses sits down with the patient for about 45 minutes to an hour, finding out their health history, what their limitations are due to musculoskeletal problems, any other issues they might have, and then we develop a program for them based on what they're currently doing and what they are able to do. And we start off slow and then build them up over time. And that's the best way to do it. Men especially like to go out to the gym and hit it hard right away, and then they get injured, or it's too hard for me and I can't do this. So we start them off nice and slow and then build them up over time. And our goal is to get most people into that moderate exercise range. And again, by the time they're done with us, they're usually exercising between 45 and 60 minutes, including the warm-up and the cool-down. And then they can transfer that to a gym or to home exercise or stay with us, because we do have a post-cardiac rehab program also.
Now, when I was there, I used these.
Wall pulleys?
Yeah, the wall pulleys. Yeah,
Yes.
they're very interesting here. I had not done the wall pulleys before until I went to cardiac for some reason or other.
Yeah.
I don't know. You know, here's what I found interesting about cardiac rehab is that you see all ages, men and women, all shapes and sizes.
Yes.
You know, I really felt bad because there was one woman in there, and I don't recall her name. I used to say hi to her. Hi, how are you? Very young, and she does not have the use of her left arm and walks with braces. And so this is what a stroke and a heart attack can do, even to young people.
Right,
Absolutely.
absolutely.
You've got to pay attention to your diet, because why?
Your diet, if your diet is high in fats and cholesterol, then the plaque builds up on the inside of the artery and causes heart attacks and or strokes. Absolutely, the stroke is another issue. We don't see the stroke patients because they have very different needs than what we can help them with, but we can see them afterwards, after they've already gone through their physical therapy and occupational therapy with those folks who are very specialized in what they do. But you want to limit the effect of your diet on your arteries. You know, we all have family history that we have to contend with, but diet absolutely is a big piece of it. If you have high cholesterol, the plaque builds up earlier. That's when we see young guys who have high cholesterol, those kinds of things coming in with blocked arteries. And as we get older, the cholesterols go up, plaque builds up, so we just need to be very, very cautious with our diets.
That's one of your assistants right there helping.
It's one of our
patients.
interns, current interns.
Okay.
Yes.
Okay. And so you would tell a patient like this, do how many reps, depending on how much he or she can do?
What we usually do is we do it by time on the wall pulleys anyway. And so this gentleman, I think, is doing about 5 or 6 minutes on the wall pulley. So he'll probably do about 4 or 5 sets. He's going to do 8 to 10 repetitions of each of the exercises that we have him doing on the wall pulley. And then when his time is up, he'll move into a different exercise. So we do it a little bit differently. We don't do 20 minutes on one exercise. We usually break it up throughout the hour that they're with us. And so it's in intervals. So they'll do a leg exercise, arm exercise, and then a leg exercise and arm exercise, unless we put people on the resistance circuit, which is the weight circuit in the back of the room, and then they're usually on there for about 15 minutes.
That looks like a very young woman there in
She
a white
is.
shirt, and she had some heart issues?
She did?
Really?
Yes.
She looks like she's maybe in her 30s?
She is, mid-30s.
Wow.
And the gentleman that you were looking at in the other shot, he's in his mid-80s, I believe.
Wow.
So yeah, wide range of ages of our patients.
Yeah, and she looks thin.
She's
She doesn't
in
look
she's
like
in
she
great
has-
shape.
Yeah, she doesn't have
Yeah.
weight issues,
No.
but it's hereditary maybe.
Yeah, she had a congenital issue.
Yeah.
Yeah.
And so you're not going to go 20 minutes. Well, you have so many machines in there. So you go a few minutes here, a few minutes there, then a few minutes back over here. So it's a wide variety of
Correct.
machines.
And we have those for a very good reason. People have different needs, different likes and dislikes. And so I always tell people, if you hate a machine, you don't have to do that machine. We'll put you on something that you like.
Yeah.
We want people to enjoy their exercise because they're going to stick with it. You want to do something you love. I love to swim. So from May to October, I'm a happy camper. I'm out swimming almost every day. The rest of the year, I walk or go to the gym. So you just have to find something that you love to do that you will stick with and get that moderate exercise on most days of the week.
Yeah, a lot more to talk about here with Lori Waddell. She is the coordinator of cardiac rehab out at St. Agnes Medical Center here on a Friday morning on Connect with Me, 436 MeTV option 11. This program brought to you by Turf Medics and Lorenzo Neal. We're back in a moment.
As a pro athlete, I played on green grass my entire career and was stunned to find a product that could make my home look as good as the turf I've grown to love. Turf Medics is a revolutionary new turf coloring system designed to reduce watering and mowing. Call 1-888-936-0444 or visit the website at www.turfmedics.com to learn more about Turf Medics by Pro Turf, the real experts in real green grass.
Frigidaire. We introduced the first home freezer, the first pulsator agitator washer, and now we introduce the Frigidaire Orbit Clean dishwasher, designed with a unique wash arm that gives you 4 times more water coverage for a consistently better clean. Frigidaire, over 90 years of legendary innovation.
See the full line of Frigidaire appliances at Ventura TV Electronics and Appliances.
And back here on Connect with Me with Lori Waddell, the coordinator of cardiac rehab. Caller, you there? Hello?
Yes. I had 4 strokes myself, and
Yeah, go ahead.
yes.
You have to turn down the sound on your TV so you can hear us on the phone.
Okay, I'll turn it down right now.
Yeah. Okay, go ahead.
Yeah, I had 4 strokes.
You still got to turn it down, sir. You got to.
I am.
You got to turn down
Yeah.
that sound.
Okay.
I
I had 4 strokes, and I went to the hospital, and I had like ones, strokes, and I survived so far. And you know, what can you do for keeping having them?
What can you do? What?
Been for having more, or you know, what should I eat more?
Okay. All right. Thank you.
Okay, there's a lot of things you can do to prevent or lower your risk of having a heart attack. Big thing is don't smoke. Keep your weight in an appropriate weight for you. Exercise regularly. Eat again a low cholesterol, low fat diet, and that would again the Mediterranean diet is an excellent way to do that with the appropriate kinds of oils. We need fat. But you just want to have the right kinds of fats, which would be the olive oils and those kinds of things. So it's multifaceted. It's not just exercise. It's not just diet, but it's all of those things. Reducing stress is another piece of it. So not smoking, keeping the weight under control, and having appropriate diet and exercise.
All right. Another call. Good morning, caller. You're on the air.
I had a called uncontrolled hypertension event in late September to land me in the hospital for a week. And since I got out, I haven't had any supervision, any rehab or anything. What can I do to help get in better shape? I'm a large man with several other disabilities.
Depends on what you can do. If you are able to go to a gym and use seated exercise, if you're not able to walk, any kind of seated exercises on recumbent bikes, recumbent steppers, stationary bikes, any of those kinds of things, if you're not able to walk, are great exercises. You don't have, I said 30 minutes of exercise a day. If you can't do 30 minutes at one time, you can break that up into 10-minute bouts throughout the day to get your 30 minutes, and that works also. And the other thing I would suggest, if blood pressure is your issue, is go and buy a $40 or $50 you can, blood pressure cuffs so you can monitor at home and make sure that your medicines are doing what they need to do. And if they're not keeping your blood pressure under control, then you need to get back in touch with your physician and and have that conversation with him or her and make sure that you are getting the appropriate treatment.
All right, let's roll another piece of videotape, and I do want to talk a little bit more about what you do at Cardiac Rehab. I mentioned the staff there. Why is it such a low-key, low-stress environment? I was expecting a little more high stress and almost like a military-type environment, but it's not like that at all. It's almost like, well, okay, you're coming here of your own free will, and if you want to do the exercises, you can do them. If you don't want to, you can pretty much leave. I mean, nobody forces you to do anything there. It's really pretty much up to the patient. There's Maya there. She's really nice. Go ahead.
Yeah. Yes, we want people to have fun.
Yeah.
I don't think people will stay if it's torture.
Yeah.
So, we do want them to have fun. So we have them doing the exercises they like to do. And I have some crazy staff who, as you might remember, John, I've got one nurse who will wear all sorts of different crazy hats. She's always telling jokes. But we do want it to be a good time.
Right. Now, here's Maya taking someone's blood pressure. This is part of the procedure, right?
Correct.
You constantly take blood pressure, especially after you get off one of the machines.
Yes. Before exercise, during exercise, and at the end, we want to know what the response to exercise is. And if a blood pressure drops with exercise, that's an inappropriate response. We expect it to go up during exercise and then come back down after exercise is over. So we do monitor that. We also monitor the heart rate and rhythm. Somebody's sitting back behind the monitor doing that, making sure that the heart rates are appropriate for that patient also. And everybody's different. So we have target heart rates that are specific to each person. One person it might be 60 to 80, and the next person it might be 120. So whoever's sitting back behind the monitor is watching all those and making sure that everybody is working out at an appropriate level.
But I guess what I was expecting when I first went in there is it's the staff there with like bullwhips and okay, get on the treadmill, hurry up, get on. But it's not really like that. You have some people with high energy there. You have some people with low energy there. You have some people who have breathing issues and they need the machines.
Correct.
So everybody goes at a different pace. Everybody goes at his or her own pace.
Correct.
You mentioned before the treadmill. It's important to get that heart rate up. Why is that? Why is it so important to get it up and then for it to come down?
Getting the heart rate up is that target training zone or that target heart rate. And what that is, that's where you're going to get the most benefit for your heart. And again, everybody's different to exercise that muscle. It's a muscle. Just like, your bicep or your quads are muscles. We want to work it at a level that works it out appropriately. If you come in with a heart rate of 70, I'm going to be looking for your heart rate during exercise to be right around 100, generally speaking. Some people a little higher, a little lower, depending on what their problems are. And that's going to be an appropriate, safe exercise zone for that individual, and to get that heart rate up, to exercise that muscle, to hopefully build up some collateral arteries, some new arteries to help get the blood throughout the heart and hopefully prevent issues down the road.
Does the exercise strengthen the heart muscle? Does the exercise strengthen the cardiovascular system in the body?
Yes, it will strengthen the heart muscle. The heart muscle is one that you don't want to enlarge. You want to get your bicep larger, but you don't want your heart to get larger. So exercise isn't going to make the heart get bigger. It's just going to make it work more efficiently. It doesn't have to work as hard to pump the blood around. Your blood pressure usually will be lowered, so the heart doesn't have to work so hard. So there's multiple effects. And we always tell people that, exercise will make your blood pressure usually affect your blood pressure for 24 to 48 hours, keeping it down. Now your heart doesn't have to work so hard. So yes, it strengthens the heart and reduces the blood pressure, which then makes the heart so it doesn't have to work so hard.
Yeah, now you've been at cardiac rehab for, you said, 35 years now, and you've seen a lot of patients come and go. Unfortunately, you've seen a lot of patients pass away as well due to heart issues. But you also see repeat customers.
We do.
What's the biggest reason? I mean, you'd think, now I'm not going to pass judgment on anybody because I should be the last one to talk, but if you have a heart episode, whether it be stents or a heart attack or whatever, what's the biggest reason people have return bouts? Is it that they don't stay on their diet, they don't take their medicine, or is it just nature?
it's multifactorial. If you're a smoker and you didn't quit smoking, we know we're going to see you again. I would say, a lot of our people that we get back again, it could be 10, 15 years later. That's progression of coronary artery disease.
Yeah,
we
so
don't
you
cure
can't help it.
We don't cure it. We stop it. We fix the current problem and hopefully can slow the progression. But it will progress. So you want to do all the things you can. The right diet, keep your weight under control, lower your stress, exercise regularly, all of those things to keep your risk at a lower level.
Right, trying to prolong the inevitable.
Exactly,
is what we're
exactly.
Trying to do.
And some of the folks that we see come back, it's genetics, and unfortunately, right
Yeah,
now
that's
we
right.
don't have anything that we can fix the genetics with. They keep saying for the last 20 years we've been hearing, we're gonna figure out the gene side of it. We're not there yet, and I don't know if it'll happen in my lifetime, but hopefully someday they will be able to fix that, figure out who are going to be at the highest risk due to genetics. We can't fix which family we were born into, but we can fix a lot of the other things.
Both my parents had congestive heart failure, but that was later in life, in their 80s and 90s. Does that mean I'll get it?
Not necessarily. It is, congestive heart failure is the pump isn't working as well as it used to, and the heart is a pump. And because the heart doesn't pump as well, the fluid backs up into the lungs and into the legs and into the gut.
Yeah.
And so it's a process that heart failure goes through. And we do see the heart failure patients now. And so we do. That it started earlier this year. We started being able to get insurance coverage for them, and so we're able to impact those folks also and help them with their diets, because for them the fluid restriction and the salt restriction is extremely critical to keep those things under control, even more so than the rest of us, and keep them out of the hospital and keep them as healthy as we can.
Yeah.
Heart failure it's not a disease so much as it is a condition, and it's that the pump just doesn't work quite as well as it used to, and that fluid backs up. And so hopefully if we can keep the fluid down and the salt down in those folks, we can keep them out of the hospital and keep them going for a long time.
Okay, Lori Waddell is here from Cardiac Rehab at St. Agnes Medical Center. It's located over there right near the emergency room, same side of the building. It's on the second floor. She's been there quite a few years, a couple anyway. 436-ME-TV option 11. Thanks to Turf Medics and Lorenzo Neal for sponsoring today's program.
As a pro athlete, I played on green grass my entire career and was stunned to find a product that could make my home look as good as the turf I've grown to love. Turf Medics is a revolutionary new turf coloring system designed to reduce watering and mowing. Call 1-888-936-0444 or visit the website at www.turfmedics.com to learn more about Turf Medics by Pro Turf, the real experts in real green grass.
Back here on the show, our thanks to Turf Medics and Lorenzo Neal. Okay, an email question is, your guest an advocate of gastric bypass surgery to try to control obesity? That's kind of a difficult question, but...
For people who are overweight, that's a great option. If you have struggled with weight loss, and people do for their entire lives, it is
personal choice, though.
It's a very personal choice. And I worked with a gal who had gastric bypass surgery, and I was talking to her, and she said, "I will never encourage somebody to have this surgery."
Because why?
Because it comes with its own sets of risks. She said, "It worked for me." She said, and it's been great. And she's 10 plus years out from her surgery. She has kept her weight off, but it's not for everybody, and it has its own risks. It's definitely something that people that struggle with their weight should look into. If you're a diabetic and you're extremely overweight, all your diabetes symptoms can be gone once you lose the weight after gastric bypass surgery.
It can?
Yeah,
Really?
and the high blood pressure, a lot of the issues that go with the obesity, diabetes, high blood pressure, cholesterol issues, all of those things are affected by the obesity. So if you lose the weight, whether it's through diet or it's through the gastric bypass surgery, you absolutely can correct some of those problems. And then a lot of people who are overweight don't exercise because of their weight issues. It's hard for them to exercise. So then the follow-up to that is then they can start exercising also and improve their health overall. So I'm for gastric bypass surgery if that's what somebody needs. Again, speaking with the physician, whoever the surgeon is, and making sure that it's right for you is key to that.
Yeah.
And that's a decision between the patient and their physician.
Absolutely. Hey, roll another piece of videotape here on Connect with Me at Cardiac Rehab, St. Agnes Medical Center. So how long, once you enroll in this program here, and there's that young lady again, she's, I can't get over that, 30-something years old. You know, my brother passed away at the age of 38 of a heart attack. He was dead before he hit the floor. So it can happen.
Yes.
But it's just kind of shocking to see a young lady in here with some of the other patients. But once you enroll in this program, how long can you stay? I know it's what, Monday, Wednesday, and Friday, basically.
Yes.
Those are your days.
We meet with our monitored patients, which is what you're seeing on this video, 3 days a week, Monday, Wednesday, Friday. Most insurances will cover 36 visits. Okay. So basically 3 months, and that's, you know, we follow the Medicare guidelines, and that's the guidelines that Medicare gives us. If you miss a session here or there, we can push it out. So it really is about 3 months, and then we have a maintenance program that if you wanted to stay with us forever, and we have patients who've been doing this for 25 years with us. I started working in cardiac rehab 25 years ago, and a couple of them were there then, and they're still with us, so it's helped them, obviously. So you can stay forever, or you can just do the 3 months and then move on, hopefully, to either a gym or home exercise or whatever works.
Yeah. And I do want to mention, I know we have some more videotape here we can roll, cardiac rehab. You monitor every time someone comes in, their heart rate, their blood pressure, their weight.
Correct.
What else do you monitor? And you keep a chart in a computer.
We do.
We have the total record from day one until the end.
Yes, every heartbeat that they have, if they're wearing the heart monitor, we can look at and see what their heart rate and rhythm is. Yes, we're monitoring them, and my staff is out there with the patients, making sure they're not having any symptoms. We're correlating those symptoms to whatever the numbers we're seeing with the heart rate, rhythm, blood pressure, those kinds of things. We have a dietitian that works with us, and we'll work with people on getting them to the correct balance of their fats and cholesterol and salts and those kinds of things in their diets, and the grains like we talked about earlier, the fruits, vegetables, and also if they have weight issues and need to lose weight, she'll help them with that, again with us working with them also. So it's not just the exercise, but it's the whole education piece of it, and then changing those aspects in their life that need changing, getting their stress under control, keeping their blood pressure under control, whether that's with medicine or diet, and then exercise, of course. Losing the weight. I always tell people, let's set a realistic weight loss goal. In 3 months, you're probably not going to lose the 60 or 70 pounds you want to lose, but how about, finding a number that's doable, and that's somewhere between usually 10 and 20 pounds in a 3-month period. So we get them started, and that gives them that pat on the back and helps them to continue. We do monitor them closely. We keep in contact with the physicians. If there are any issues or problems, we'll contact the doctors and let them know if there's blood pressure issues, rhythm issues, or anything else that we're worried about. So we are in contact with the physicians on a pretty regular basis.
Have you ever had a patient come in and you've had to rush them to the emergency room?
Not very often, but yes.
Yes.
On a rare occasion. Probably, and I've been doing this again 25 years. Probably I can count on 2 hands the times that we've had to rush somebody to the emergency room. Sometimes it's the doctor says let's go ahead and take them there, and I'll meet them in the emergency room. But it's a rare occasion that happens. Cardiac rehab is probably one of the safest places that you can exercise, because we're going to catch things before they become a problem.
Not because they've exercised, but because they arrive there and they're not feeling all that well for that particular day.
Correct. Yes, absolutely. It's not the exercise usually that causes the problem. They have another problem that just happens to occur during the exercise.
Yeah, and how do you, so have you been doing this so long you can kind of spot when someone is just doesn't look right?
Yeah, it's what I call it, nurse's intuition. Sometimes you just say, I'm just not happy with the way this looks, or how you're looking today. Let's, do a little more digging. And sometimes it's just because we get to know our patients so well, come in and it's like, what's wrong with you today? What's different? And it may not be me. It may be one of my other staff, one of the exercise physiologists, or one of the other nurses who just says, you just don't look right today. What's going on? And dig a little deeper and find out what's going on, and hopefully intervene for them.
And it may not be physical, it could be mental.
It absolutely can. There's a lot of psychosocial issues with our folks also, and depression too. You know, which came first, the depression and then the heart attack, or the heart attack and the depression, and they go hand in hand a lot. So we work with them on that and hopefully help them get through that also. And we have a social worker that we can contact if that's something that the patient needs also.
Yeah, you know, there's a person that I occasionally work with. I won't mention his name, but his diet not all that healthy. But you know what his comment was when I mentioned this to him? Because he knows I had stents put in. His comment was, well, you know what? If I die, at least I'll die happy. Is that the kind of attitude that we want here, or what?
No, absolutely not.
At least I'll die happy.
Because you can still have really good food and not
so if you're a
have
heart
to be
patient,
the bad stuff all the time.
Can you occasionally go out and have a burger or a steak or something?
Yes, absolutely. And I think you and I had this conversation when you were coming through with this. Absolutely. And, you know, I have doctors who say, you know, if you follow the 80-20 rule, you're good 80% of the time, you can cheat 20.
Really? So that's the rule?
Well, that's his
kind of the golden
guideline.
Rule?
If you like steak and you want to have a steak on a rare occasion, don't have steak
How
every day.
rare?
You know, once a month or so. I don't think that's a problem. And again, you don't want to have the 36 ounce or whatever those big huge steaks are. You know, a 6 or an 8 ounce steak is fine, or share a steak with, you know, whoever you're having dinner with rather than eating the whole thing, or use it over a couple of meals. You know, our diets are just heavy with
comfort
fats.
food.
Yeah, and this time of year especially with, you know,
I know.
the rain and the cold, we want to have our comfort food, which is, you know, fatty foods and those kinds of things. But, you know, fill up your plate with the vegetables rather than the fatty foods.
That's right. So do I want to die eating a carrot or a nice juicy burger?
Oh, the burger, of course, but add the carrot later.
All right. We're going to be back with Lori Waddell here of Cardiac Rehab at St. Agnes Medical Center, 436-ME-TV, option 11. Thanks to Turf Medics and Lorenzo Neal for being our sponsor today. Back in a moment.
Almost time.
Now we'll find out once and for all about Clark Kent and Superman.
Look up in the sky. It's a bird. It's a plane. It's a TV show.
Yes, but who is he? What's his name?
He's Superman.
Golly, Clark, won't that be wonderful seeing Superman?
Fighting a never-ending battle for truth, justice, and television the Me TV way.
No one can do the things that Superman does.
The Adventures of Superman.
Now on Me TV Fresno, Xfinity 187.
All right, back here with Lori Waddell of Cardiac Rehab and talking some serious issues, but you know, you can cheat once in a while. Hey, we have some more videotape, I think, another clip that we haven't used. And so while we're looking at the clip, we can have another email question that we can throw at you here, Lori. Okay, what percentage of rehab clinics' caseload is from congenital heart problems which are acquired?
Congenital problems are, you know, usually something you're born with, and some of our patients who have valve issues, the heart valve issues,
hereditary.
Those are not hereditary necessarily, but they were born with them. So it's a congenital. It's something in the development of that baby goes wrong somewhere along the way. And percentage-wise, it's not a lot. It's probably maybe 5% or so of our patients that have that. Hereditary is different. That's where you're getting this from mom and dad or your grandparents or whoever, and that's a good portion of us have those kinds of issues and things that we expect. That's the recumbent bike.
Oh, okay, yeah.
And again, we have multiple kinds of bicycles and seated exercises because our patients have a lot of different kinds of orthopedic issues.
Yeah.
So the seated exercises work really, really well for our folks with knee and hip and back issues. That particular bike has a great support on the back, so folks with back issues, that's a great piece of equipment, so that all those folks are on our recumbent bike. In the back there, we've got the elliptical trainers. This group is a little bit older other than the young lady, so nobody yet is on the elliptical trainer. I think she uses the elliptical, and then we have the treadmills and the resistance circuits and a couple of other kinds of bikes. The new step, which is the recumbent stepper, is another one that's really, really good.
I've used that one. I like that.
It's a great piece of equipment and American made. So that's really nice too.
Yeah, and so if you do have a valve problem in your heart, it can be surgically fixed sometimes?
Oh yes, absolutely. No, absolutely.
On the situation?
It's the valvular issues are either valve replacements or valve repairs are pretty common. And, it can be from a congenital issue, it can be wear and tear, or just, we don't know sometimes why they, the
If
vessel or the valve gets stenotic, and then we have to replace it.
If you have ankle swelling, is that an indication that you have heart problems?
Can be, absolutely.
Really?
Yeah.
If you're collecting fluid?
If you're collecting fluid, again, that's that pump. If the pump isn't pumping as well as it should.
Yeah.
Some of us, if we eat Chinese food and we, it's got a lot of that MSG in it, there's that sodium intake will cause us to have the swollen ankles. And that just, that's the reason for that. But folks who didn't necessarily go out and have Chinese food and they've got swollen ankles, it could be that the salt and fluid intake and the pump is not able to move that fluid around as well, so it has to go somewhere. It's like, that overflowing toilet. It flows over into the lungs and out into the ankles and feet. And we watch that very closely in our heart failure patients who come to visit us. We listen to their lungs every single time they come in, and we look for their edema every time, or the swelling in their ankles every time they come in. So we're hopefully getting on top of that. If I see a big change, I'll say, what'd you eat differently? What's going on? We try to get them to make those changes. And if they're having symptoms, then again, contacting their physicians.
Is cardiac rehab a place where you can come in and, of course it's for rehabilitation of the body, but is it also to gain an education on how you should take care of yourself because you have this problem now and you have to deal with it to a certain extent, or you may not be here?
Absolutely.
So is it like an educational center as well?
Exercise and education, and education is a huge part of what we do. All the patients get a packet of information that includes that information on exercise, blood pressure, diet, stress reduction, and then if they're a diabetic, we have information on diabetes. We again have the dietitian who will meet with the patients one-on-one if that's what they need, or give them printed information if that's all they want, whichever they want. So it absolutely is key, the education piece of it.
Caller, go ahead. You're on the air with Lori. Hey, caller, go ahead.
Hello?
Yeah, you've got to turn down the sound on your TV, though.
I'm trying to get her down now. I was calling in regards to, not about the valve in the heart, but I have afibrillation, and Dr. Hanks is my doctor as well, and I'm going in for a cardioversion, and I was just a little scared and apprehensive about it. I was just wondering when this procedure is done, is it got a pretty good rate at staying fixed, or is it something that can temporarily be corrected and then eventually goes back to the same problem again? What is the percentage on that, and is there anything that could pose a problem in these type of procedures?
Okay.
Yeah, atrial fib is corrected with the cardioversion, like you're saying, or medications, and so usually if you're going in for the cardioversion, the doctor will be there. It's a fairly safe process. My husband has had several cardioversions. Yeah. And cardioversions, or the atrial fib is wiring. It's the electricity in the heart is a little bit off balance a little bit.
Electrolytes? Is that when they talk about
it's the electricity. The electricity goes through the heart and makes the heart beat.
Oh.
And so I just, there's plumbing issues, which you had with the arteries having blockages, and then there's electrical issues, and that's the heart rhythm is the electrical issue. And so what this gentleman has is atrial fib, which means the heart rate is fast and irregular, so it does not beat effectively. And they can also have the same kinds of heart failure issues that you see people with a pump issue.
What's that, caller? Go ahead.
It's just basically, I guess, a high risk of stroke or something from blood clots or whatever. But I've been doing what Doctor said. I've lost 176 pounds and quit smoking, so I'm feeling a lot better. But
good for you.
I've got this coming up in about 2 weeks, and I just wanted a little more backing on it and find out a little bit more. And it doesn't sound as scary now as it did. It's sort of a wake-up call, big time. But
I guess it's pretty common, so
Yeah.
I'm just going to go with the flow and see what
All right,
happens.
caller. Well, listen, if you got Dr. Hanks, you're in good hands. Not to worry.
Yeah, isn't he a great guy?
Yeah.
He's just terrific.
Yeah, he's got a great
Okay,
sense
thank
of humor.
you so much.
All right, thank you. So one final thing before we go here. Got about another minute before Tal comes up here, but I want to ask you about getting back to diet, because there's another friend of mine. He's a guest here all the time. His name is Dennis Hart. He goes, "You're afraid to eat anything." He says it took you 50 years to clog your veins. Your veins are clear now. Okay, it's going to take you another 50 to clog. No, it's not.
No, wish it was that way. But it's a progressive disease, and you're not going to like what I'm going to tell you, but you probably have other blockages in other arteries, even though it may be only 20 or 30%, and we're not going to treat that. But that doesn't mean that can't be 100% in a short period of time, because it's not just the lane.
So why didn't Dr. Hanks put the stents in the other?
Because we don't want to play around with those and cause a problem.
Oh,
So,
okay. But 20% is not going to kill me.
Correct.
Okay,
Correct.
as long as I take my medicine.
And you're doing the right things, and
Yeah.
hopefully you've slowed that progress, slowed the progression of your coronary artery disease.
Yeah.
Yeah, I wish it was, if I have this at 70, I won't have it again until I'm 140, but it doesn't work that way. Yeah, it just, you lay, you're not just laying it on slowly. And a lot of times what happens is you have a piece of plaque in there, in that artery, that's maybe only 40 or 50%, and it ruptures or moves away from the wall. It becomes like a sore, and so the body sends all the platelets and all the stuff to it and makes it a scab, which now you've taken a 50% blockage and made it a 90 or 100%. So it's not that just slow laying on of the plaque, but it's the rupture of the plaque that then causes the problem.
How about stress, real quick?
Stress is key. When you're under stress, your body releases stress hormones, which are very caustic to the lining of your arteries. Yeah. And so, we need to have our stress under control. Everybody has stress. We can't be alive today without some stress. It's how we handle that stress. Yeah. Letting it roll off your back is much better than keeping it in and
festering.
Exactly. Yeah. You've heard about people who were doing great and they have a family crisis or are under a lot of stress and all of a sudden have a problem, and it does happen. Yeah. It's another piece of the puzzle. There isn't one thing. We've talked about exercise and diet and blood pressure and diabetes and smoking, and all of those things play a part in your developing heart disease. It isn't just one, but it's all of those, and that's why we treat all of those problems.
Okay, Lori. Oh, it's good to see you.
It's great
you
to
look
see
great,
you, John. It's
but
great
I hope
to see
I don't see you for a while.
Absolutely. Just come to say hi. Don't come to play.
Say hi. Yeah,
yes, we'd love
right.
that. We'd love that.
I love you, and I love all you people over there.
Thank
you do
you very
a great
much.
job. You
Thank
make me
you,
feel
John.
so comfortable. It's like I'm part of your family over
You
there.
are. Everybody becomes part of our family.
Okay.
Absolutely. Thank you so much.
Thank you. Lori Waddell, she is the coordinator out there at Cardiac Rehab at St. Agnes. We're back with Tal Cloud, and our thanks to Lorenzo Neal and Turf Medics. Back in a moment.
As a pro athlete, I played on green grass my entire career and was stunned to find a product that could make my home look as good as the turf I've grown to love. Turf Medics is a revolutionary new turf coloring system designed to reduce watering and mowing. Call 1-888-936-0444 or visit the website at www.turfmedics.com to learn more about Turf Medics by Pro Turf, the real experts in real green grass.
A top secret location. It's the spies who love me, bringing together MeTV's top super spies to fight evil at a memorable moment's notice. They're daring.
That's right.
Brave.
Now what are we gonna do?
The best we can.
Suave.
Does that apply to me, Oscar?
Possibly. And smart.
The old finger in the gun trick.
Maxwell Smart.
MeTV Fresno, channel 43.6 and Xfinity 187.
Welcome to a new beginning. An adventure that goes well beyond passive diversions. Empowering through exploration. Engaging your passions. Inspiring with lives lived outdoors. Come with us. Untamed Sports TV.
You can find Untamed Sports on over-the-air channel 13.8.
Frigidaire. We introduced the first home freezer, the first pulsator agitator washer, and now we introduce the Frigidaire Orbit Clean dishwasher, designed with a unique wash arm that gives you 4 times more water coverage for a consistently better clean. Frigidaire, over 90 years of legendary innovation.
See the full line of Frigidaire appliances at Ventura TV Electronics and Appliances.
Back here on the program, thanks to Lorenzo Neal and Turf Medics, joined now by Tal Cloud. How are you, Tal? I feel like I'm joined at the hip with you.
Yeah,
we're kind of broadcasting partners here. We do Power Talk.
Yes, we do. Had a lot of fun out
over
Power
there.
Talk.
And now you're filling in for me this coming Monday. And I want to mention to everybody that my daughter, Angela, 11 years old, is going to have hip and ankle surgery at Shriners Hospital in Sacramento on Monday. This has kind of been a year in planning, and so it's from the E. coli bacteria that she suffered back in 2005, and so she's had some physical ailments due to that. She had kidney failure and several strokes that have given her motor skill problems, and so hopefully this will straighten out whatever's going on there from a physical standpoint. So you're going to be on the air here on Connect With Me 3 days next week. And
yeah, I'm excited about it, and good luck
have?
with your daughter.
Thank
yeah,
you.
No, I'm really excited about doing it. It's the first time I've done this, and I've had fun doing Power Talk like you have. We commiserate back and forth how that's going. So it'll be a new learning experience for me, and hopefully the viewers will enjoy it as well.
What do you got coming up Monday? That's what I want to talk about.
Monday, Monday we're gonna have a good show. When I was in here last week watching, we were talking about kids and what are kids doing, and I think it's important that a lot of kids are doing a lot of great things in this community. So there's a group of kids out in Sanger at Sanger High. They're in FFA. They're in a Paramount program where they can literally get college credits in high school. So we're going to talk about a whole bunch of different things that are going on at Sanger High and their FFA and their agricultural program. That's a little bit different than what people are used to seeing.
Sure, that's good. And then Tuesday, you got a
Tuesday, I'm going to go another route. I think this will get a lot of people. There's a lot of talk about Common Core. And, there's a lot of people that are very upset about Common Core. But I want to take it from another perspective, is that Common Core is as good as bad as you make it. And I've got some guests that are going to come in and talk about how they have administered Common Core and maybe shed some light on the other side of Common Core, the side of Common Core that if a school district has the right attitude, they can take advantage of Common Core. And I think we're going to show some examples, I hope, of questions in the classroom and different things about Common Core that maybe the viewers haven't seen before. So I think it's kind of interesting, and hopefully people will too.
And I know on Wednesday you talked about it because I heard you commiserating there with our buddy Marcus right here, our floor director, about Wednesday's show is a kind of a special business segment, right?
Right. I think you want to do business on Tuesday, but unfortunately I flipped that up. I didn't know when I scheduled my guests. But
no problem.
I thought it'd be fun to look at a business that's just starting up, less than 2 months old business, brand new business, what it took to get started, a business that's real close to that one that's been around for 70 or 80 years, one of the last businesses in the state that has a liquor license that allows them to sell beer in the store and drink beer in the store. It's the last one in the state that's operational from a bygone era. Yes, it's a bygone era. It's here in Fresno County. So I thought it'd be fun to talk about the differences, and they're right across the street from each other.
It's on the east side, right?
It's on the east side, out in Sanger Country, but it's something that people probably aren't aware of. They've probably driven by it 100 times and it would never stop. But it's very interesting, what about this business. So
the last of the Mohegans, right?
It's literally the last operational license in California where you can go and buy milk and cheese and a sandwich and have a beer and drink it in the store or on the property. You go to a lot of places.
Right.
Not that that's the main part of their business, but a lot of people, go there in the evenings and have a beer, and it's not a bar. It's just it's a store. So you have people.
Of course, most, as you know, we only got 1 minute, but most places, like if you go to 7-Eleven, there's no drinking or loitering on the property.
Right. And this is not a bar per se, but it's just a unique old store, been around for I think 80 years, 90 years. So very old business.
Wow.
Yeah. So and then we're going to talk about business lending with CenCal Business Finance as well. Talk about, programs for micro loans, which are small loans under $50,000 and loans up to $2 or $3 million. So
hey, we got 30 seconds left. How's business here in Fresno?
I think business is good. I think there's a lot of opportunities for people that want to take it. And we have a great community, and I'm just thrilled to be here and thrilled to be a part of it. And so I think Fresno's business is looking up.
Yeah. Hey, good luck on Monday and Tuesday and Wednesday, and good luck you're on Power Talk today.
I'm on Power Talk this afternoon, so if anybody wants to get on Power Talk 96.7 AM 1400. Tune in. Call in, too. Ask me some questions.
Hey, Tal, thanks for filling in for me.
And good luck with you.
Thank you.
I'm sure it'll be great.
Hey, I appreciate it. Consider you a friend of this program's and a friend of mine, and I appreciate your time.
Hey, it's going to be great.
All right. Tal Cloud, going to be here with you here on Connect With Me Monday, Tuesday, and Wednesday. Keep my fingers crossed for my daughter's surgery. Have a great weekend. See you back here Monday.